how to do an intramuscular glute injection for TRT. I'm gonna bring you guys in a little bit closer and show you my supplies. So first off, we have our testosterone cypionate. They put this in a pill bottle for packaging. We're gonna go ahead and crack that open and show you guys the vial. Now you see this little green thing here on the side. This is what is typically stuck on the top of the vial. All you have to do is just pry this off with your fingernail, and that gives you access to the rubber seal here. This is a 200 milligram per milliliter vial, and that is what we prescribe at my clinic, Harley Meds. Then we have our 1 cc syringe. We have a 20 gauge 1-inch needle to draw the testosterone out of the vial. Then we have a 25 gauge 5/8 inch needle to inject with. And of course, we have our alcohol prep pad. Now, the area we're working with has already been fully sanitized with an alcohol swab. If you guys are working in your bathroom or your kitchen, whatever it is, just take one of these and wipe down the area real quick, get it ready for injection. Just make sure you have nothing, no contaminants on the table. So we're gonna go ahead and pop open our 1 milliliter or cc syringe and set this down. We're gonna grab our drawing needle out of the plastic and set that down. Now, the way that these work is they actually screw into each other. So all you have to do is take the needle and screw it into the syringe. Then it has a removable cap like this. So the first step to get ready for the injection is to pull back an equal amount of air of what your dosage is. So personally, I'm on 0.45 twice a week. It is Tuesday, so I'm gonna do my Tuesday injection here. I'm pulling back 0.45 on the syringe and filling that with air. Now we're going to equal the pressure inside of the vial because the vial is sealed and pressurized. If you were to not pull back air on this, it might be a little bit difficult to draw the testosterone out because it's gonna have a suction effect. So the reason that you inject the air in first is to balance the pressures inside of the vial. So we're gonna go ahead and do that now. Then we're gonna plunge all of this air directly into the vial. As you can see, the testosterone is coming into the syringe there, and then bring it right up to my dosage, 0.45 on the syringe. Then we'll go ahead and pull that out, set the vial down. Now here's the important part when we're switching our needles. So you're gonna pull back all of the testosterone to the back of the barrel. I like to flick it so we get all the stuff out of the drawing needle. Then we're gonna go ahead and cap this back on and screw off the drawing needle and set the drawing needle off to the side and open up. You can set that down, it's not gonna go anywhere. You can open up the injection needle and go ahead and screw that on. When I first got started on TRT, I was really confused about how to get the bubbles out of this. So like I said, pull your testosterone all the way to the back, give it a couple of flicks. This is gonna cause these bubbles to go up to the top, and then just slowly move the testosterone up until you get 1 drop out of the needle. There we go, 1 drop coming out of the needle. Now, we're ready to prep the injection site. Before we go through with the injection, I'm gonna show you guys the exact spot on your glute that you're gonna be targeting. So the easiest way to do this is to split your glute into 4 quadrants, 1 vertical quadrant and 1 horizontal quadrant. You guys can see I had circled my area for the upper outer glute. It's also called ventral glute. This is the target area that we're going for our injection. We're gonna take our alcohol prep pad and just clean the injection site. Wait for that to dry. Go ahead and pop the cap off of the needle. We're gonna go ahead and poke in and then slowly do the injection. Now I like to stabilize it with my other fingers here as well. Usually it takes me about 45 seconds to a minute to complete the injection. Just breathe nice and normal. You guys can see it's moving very slowly. And we get a little more. Now I leave the needle in for about 5 to 10 seconds just to let the oil fully get in the system. And it is normal for 1 or 2 drops of blood to come out. But as you guys can see, there's barely anything. So that's pretty much it, guys. As you saw, the process is pretty dang easy. And again, we really appreciate you being a patient at Harley Meds. We love serving you at a high level and can't wait to see you have the results. I'll see you in the next video.